Good evening. My name is Dr. Locoli. Today I'll be talking about barriers in Laren American for the management of locally advanced breast cancer. Breast cancer is a malignant disease with a high burden in Latin American women. The high mortality in this region may be explained by reasons such as late stage and diagnosis, lack access to specialized cancer center, and limited help ensure coverage a high-cost medication. Locally, advanced breast cancer is to turn use to define a large and heterogeneous group of large, node-positive tumor or inoperable breast cancer with often unfavorable prognosis. We a defender to main barriers to domination of LABC in Latin, high burden of locally advanced breast cancer, inadequate access to medical facility and resources, three, for access to specialized management, and four, insufficient research of breast cancer in Latin. High burden of locally advanced breast cancer. A mammography represents the most effective tool for detecting breast cancer in its earliest and most treatable stages. The program among the most vulnerable population in Latin shows clarity is patients occur insufficient resource of job services to deliver results and very low integration with the rest of the job systems. In the case, in case where mammography is not available, ultrasound could be alternative for young patient and patient with dense breasts. So study report a high sensitivity of ultrasound compared to mammography of a first line screen method in this population. However, ultrasound has little to offer in mass screen due to its inability to detect microcalcific and a high rate of false positive results, so it cannot replace mammography. Uh, Inadequate access to medical resources. In low resource settings, centralization of cancer care facility is a common barrier to achieving the standard of care is in developed country. The spread and access to a specialized facility are characteristic of Latin of where flu specialized cancer centers and are mean lucky in a minority of economic reasons. Regarding radiotherapy services, frequently used as an indicator of cancer control, the ability of infrastructure, only Chile, Brazil, of enough facility and machinery units to cover the demand on the country Bolivia, Paraguay, and Peru have the highest unmet demand. Additionally, internationally, Atomic Energy Agency added conductor in several Latin centers show the different chances in the quality of services, such as processes, organization, APACs, education training, a number of radiation oncologists, medical processes, and medical technologies. Um, for access to specialized cancer care, Latin countries have made important progress improving gel system. However, much more needs to be done ensure sufficient access to healthcare resources for the majority of the population. Several efforts underway in Latin to improve financing of cancer care for poor patients. In Peru, data from the National Institute of Neoplastic Disease showed that there was an increase in the rates of care for patients covered by social funds of the National Cancer Control Program, Plan Esperanza. Bien. In sufficient resource of breast cancer, in Latin, there are several barriers to carrying out clinical research in a survey of Latin American members of the American Society of Clinical Oncology regulation, loot budgets, JICOs, and poor finance management were identified as barriers to conducting successful clinical resources. On the other gem, strength can also be identified such a jurisdictional level of resources and the staff common interest of patient and researchers as well as research to participate in large academic trials. In addition, there are several local and regional corporate groups that promote clinical research. Other barriers to LVABC management despite advance in the diagnosis and treatment of breast cancer, factors such as efficiency, environment, culture, education, socioeconomic level, and lifestyle are various gender its early detection, which include causes, differences in the incidence and prognosis of people who lie in the same geographic area. Social and cultural barrier prevent patient access to early detection and treatment program for breast cancer. Some of the or related to fears such as suffering, dying, abandoned children, season to be an object of desire, losing judgments, taboos about the incurability of cancer, perceiving it as synonymous with the and the generation of various feelings such as anguish, pain, helplessness, anger, compassion, and extreme worry. Is it possible to improve LABC result in Latin? This current cancer mortality trends over time have been observed worldwide. However, although a decrease in breast cancer mortality is observed, it remains stable in several Latin countries. Best outcomes are seen in breast cancer patients who have private insurance in contrast to those who have public insurance. The reflex disparity is access to jails services. The overall 5 year survival breast cancer with regional disease in 47.7% for countries with less developed jails services in contrast to 17.547 countries with more developed jail services. Several strategies as when proposed to improve the outcome of LABCM on and other types of breaks cancers in low and middle income countries such as one, invest financially in awareness campaigns and training of community jeff workers in order to educate the population and at the same time perform clinical breast examinations. Two, increase specialized training in mastectomy in order to improve quality and obtain better patients' outcomes. Three, implement cost-effective chemotherapy regimens to increase the likelihood the patient receive optimal care, improving cancer outcomes. Four, establish adequate infrastructure to perform radiotherapy and train a specialized personnel. Five, implement more economic strategies in radiotherapy. For example, shorten therapy regimens will maintain treatment effectiveness. Conclusion, there are several barriers to LABC management in Latin that are not linked, are equality address and are responsible for the poor result of in the region. To overcome these barriers, a number of activities must be carried out, including improving Breks cancer screen programs, increasing funding for cancer care, adopting of a national clinical guidelines, and development of further research. It will be possible to improve patient outcome and inquiry of like these efforts are carried out appropriately. Thank you.